Occupy Medical is a clinic that is open to all populations. However, the frostbite that we are treating is only with the unhoused. When you get your socks wet and you go walking around in the snow, then those ice crystals form inside the socks and can cause pretty rapid freezing of that tissue. With the people that are housed, of course, they can just go home and then warm up again. The danger is that they might warm up too fast and then they get chilblains. That's very easily treatable on its own. Your body can recover from that in about a week. But with the unhoused, there is no place to warm up. We had one night that the Eugene Warming Center, which is one of our allies, was closed for various reasons. And that night, that's when we had all the frostbite victims. So the subsequent clinic, we had people that their shelter is a shopping cart with a tarp over it, or if they're lucky, they're in a tent. There's no place for them to dry their socks. There's no place for them to warm up. And so that wet encasement just froze onto their feet, and people came to us and their feet were starting with black at the tips, large swelling blisters, going to purple, going to red, and then pink tissue. And the kind of treatment that you have to give when it's black tissue is antibiotics along with constant care. It takes about 1 to 3 months depending on what kind of damage there is to recover from. Normally we're seeing it on the feet. There's a little bit of swelling that people have exhibited on fingertips. Sometimes people can get frostbite to the ears or to the cornea of the eyes, but most of the people that we are seeing, it's frostbite to the feet. And my concern is tonight, our warming center unfortunately will not be open again. So I'm worried that people that are just now recovering from the frostbite that they got in December, it is now February, will get worse. And we're just so close to getting these people to the point where they've got normal tissue. One of our patients we're particularly concerned about, and when she's been to the hospital a few times for this frostbite, and my concern was, and this is why a surgeon looked at her, was that she would lose yet another toe. And when you're on the streets, particularly if you're an elder, which this patient is, and if you're a woman, you need to be fast on your feet, literally. It's very aggressive, it's really brutal out here. If you're slow or you show any sign of weakness, you will be a victim. And that continues that cycle of mental illness, and then it's difficult because people are already suffering from some hypothermia to make really good decisions. So we're really trying to encourage people to help others, their community members out by helping them stay warm, distributing dry socks, encouraging the City Council and other members to keep the Eugene Warming Center open, as well as treatment areas such as Whitebird and, of course, our group, Occupy Medical.